Hello, my name is Jill Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important topics of interest to our community. Today, I'm so excited to introduce two new pediatricians who have recently joined Northwestern Pediatrics, and also Dr. Deanne Haag, who we all know is also here to help us to get to know this entire team. So I'm so pleased to introduce Dr. Scott Spicer, Dr. Jennifer Covino, and Dr. Deanne Haag. So thank you so much for being here on this show. And you know, we've been through a lot with pediatrics. There's been some changes, and we're so thrilled to have a full complement of physicians at Northwestern Pediatrics. So thank you both for joining our team just recently, and of course, Dr. Haag, we'll learn about you and how long you've been here and have been a rock to the practice. So thank you so much.
Thank you.
So let's start off and just get to know you a little bit. And I don't know who wants to go first, but Scott, you want to go first and talk about yourself a little bit, maybe about a little bit about your background, your training, and where you're from.
Okay. So I grew up in a small town, a small community similar to this area in upstate New York or northern New York, and actually went back and practiced when I came out of residency, and have practiced there for the last 8 years. Mm-hmm. And similar full scope pediatrics with everything from babies to adolescents and college students, and you know, I enjoy doing a little bit of everything.
Wonderful. Excellent. And what about you, Dr. Covino?
So I grew up in Arlington, Massachusetts, which is a suburban town about 20 minutes north of Boston, and I came to Vermont to attend the University of Vermont Medical School. Mm-hmm. I finished my training there and stayed for pediatric residency, which I completed in June. So I'm coming straight from training. I'm really excited to be part of the team.
That's wonderful.
Yeah.
And you both chose Vermont. Is there what's it about Vermont?
I definitely have to say Vermont's very beautiful. And,
yeah.
A lot of outdoor activities, lots of skiing. And as far as this area, this community, I was impressed with the community and the atmosphere at both in town and at the hospital when I interviewed.
Excellent.
And my first experience at Vermont was interviewing at the medical school, and when I came, I was just kind of blown away by the people who were there and how collegial the atmosphere was, and enjoyed the balance of kind of working hard and good quality of life, lots of time outdoors, keeping yourself healthy, kind of really being out and about, but really it was the community that kind of drove me here and kept me here. So.
Nice, great. Well, it's wonderful to have you both here.
Thanks.
Also, Dr. Haag, let's hear about you. You've been here a while, so tell us about your background too. Let's hear about that and how long you've been here and why you're still here.
Sure. Well, I grew up in southern Vermont, so the deep south, and only left Vermont for the 4 years that I went to undergraduate college at Union. Came back and did both medical school and residency at the University of Vermont, and just love my state, wanted to stay, but definitely wanted to be up north here. I did some training during my medical school career with formerly Mousetrap Pediatrics with Dr. Chip and Dr. Holmes, and I just really loved the family atmosphere, how they took care of their patients, and that intrigued me. So right out of residency, I've been here now 14 and a half years, if you can believe that, and I love what I do.
That's terrific. That's terrific. Now, we've got more than one location for Northwestern Pediatrics, so maybe tell us a little about those locations and where you're all practicing and who your colleagues are, because there's more than 3 of you.
So we have 3 total sites at the moment. So I'm out in Enosburg, and Scott has joined me out there. Okay. And then in Swanton, we have Dr. Chippinelli full-time now. He also spends 1 day a week at the MVU High School, which is kind of a unique and
That is
fun.
really cool, isn't it?
Yes, yes. And so I think the community there really appreciates that and enjoys having him there. And then we have our main site, which is the St. Albans site, of which Jen has now joined, both Dr. Heidi Zvolensky and Dr. Roya Mansurani, who have been there full-time. and most recently joined by Dr. Strauss, Stacy Strauss, who was up with me for a little while, and Dr. Laura Bellstrom has joined us as well, which has been nice in the last year.
That's terrific.
We have a full complement of pediatricians now, which is nice.
We do, and so we have obviously Northwestern Pediatrics, and we also still have Dr. Joe Nasca, who's practicing in Georgia.
Correct.
As well. So he has the southern tier. He's a private physician, but very important in our in the care of our community of children. So it's really fantastic to have this complement. So tell me a little bit about your practices, or the practices that you want, because you're building a practice. So do you specialize, or what do you like to see, and also, Dr. Haag, what has your practice become? And so tell me a little bit about your practice, and tell the community about what you want to be seeing.
So for me, I'm joining Deanne up in Enosburg, and so I already have some patients that used to see Dr. Strauss, who moved down to St. Albans office. So it's a little mixture of children from babies and toddlers up through high schoolers and teenagers, and I think that as far as what I'm looking forward and what I'd like to build in a practice is kind of the full complement of all children and families. And for me, that I enjoy having involvement with the entire family and all the children.
It's great. And it's also great to have another male pediatrician, I think, on our team as well. So that sometimes folks want to have that choice. So that's with Dr. Chip and yourself, that makes a nice complement as well.
Yes.
So.
And I think I'm just starting, excuse me, my practice. But I really do enjoy working with children of all ages. I love the newborn period, particularly. I have a 4-month-old, so it's been interesting to kind of work through and see all the developmental milestones in real time.
Right.
But I do really love newborn nursery care and being part of that team. And then I also really enjoy working with the adolescent population, because I just think it's a really interesting time of life where the kids are trying to kind of exert their independence, but at the same point in time still kind of looking for guidance and help, and figuring out ways to kind of support them along that journey is a lot of fun. And so I really enjoy that population a lot.
Excellent. And what's your practice grown into?
I love it all, and I think that's what I like most about pediatrics. It's like that proverbial box of chocolates. You never know what you're going to get. You could walk in a room and have a baby that can't talk to you or tell you what it is, and you have to be a real detective to figure out what is bothering them. And then you can have a room that you walk into where you have a child who's very, very talkative about everything but what they're there for. And then you can walk into a room with a teenager that you have to really sort of break down what it is that they're looking to tell you. And so it requires a good grouping of skills in many different areas, and I think I enjoy that it's never the same thing twice. So I really enjoy that. I especially enjoy working with young families as well, who are just starting out and have lots of questions. And I feel like because I'm a mom myself, I'm not necessarily a better mom because I'm a doctor, but I think I'm a better doctor because I'm a mom sometimes in this situation. And so as my kids grow, I feel like I have more to offer in way of advice because I've just been there. So that really helps.
Oh, that's a great point.
I enjoy that part.
Yeah. So what is the age that you care for? Because I've heard some stories where they don't want to let go of you. So I get the 0 part, but what's the other end?
It really depends. I like to joke that we have what we call the college incentive program. It is very, very hard to find another doctor for those 4 years that you are in.
Sure.
Yes, and so a lot of times we'll be that home base, that medical home that they've built during that time. But once you're either out of high school and doing, your work that you're going to do for life, or out of college and doing your work that you're going to do for life, it's a good idea then at that point to transition to healthcare from an adult doctor. I love how they say, I need a grown-up doctor, which is probably true.
So what are some of the things that you see with children? do you in this community? What's the most popular diagnosis that you obviously hopefully healthy and well? We want those healthy and well visits, right? But other things that that you see with your patients.
I think right now it's kind of respiratory season is hitting, so we're seeing lots of people
the winter
coming in with
months are
cold
here.
viruses, and also some pneumonias and all of that as well. So I think that right now has been our biggest diagnosis, at least that I'm seeing in the office.
And so when you think of us being in the winter months, what tips do you have for parents? I mean, how do you prevent that, or what's some wisdom that you have or advice that you have for parents regarding respiratory and this winter months?
So I think hand washing is
Hand washing.
very important, and doing your best if you're obviously sick and having a fever to stay home from school or daycare where you can spread.
Never underestimate the very basic things, like enough rest, good healthy food choices, getting plenty of fruits and vegetables in your diet, using things as simple as a humidifier, drinking lots of water. If your body is well taken care of, then it can fight off things a lot easier. And so those are key staples to health in any time of the year.
And I think just in general, vaccines are also very helpful as step one of preventative medicine, and kind of doing their best to come in, get the flu shot early, kind of be up to date on everything. So something that we can help with along the way.
Anything else?
So I think one of the other safety considerations to take in mind this time of year would be, depending on what fuel source you use at your house or residence, making sure that you have smoke detectors, carbon monoxide detectors.
That's an excellent point. Yeah, fuel, what are we using, whether it's wood, what type of heating do we have? Yes. So safety in the home.
Avoiding tobacco smoke exposure to children is key for any kind of respiratory illness. It helps reduce the number of ear infections that a child has. That's been well proven. So if you're able to reduce, or better yet quit, that exposure, then it really helps children stay healthy.
Yeah. So you all have your own families, and how do you keep your families healthy? So what do you do for your health of your families and children?
Well, as I mentioned, I think really the basics are the most important part, you know, making sure you're getting plenty of rest, healthy foods, drinking lots of water, just lots of care and concern, paying close attention. It's hard sometimes when you're a doctor to pay close attention to your own children, but doing that so that you can sense when something is different.
And I've seen you out on the trail with your family as well.
Yes.
So you're staying active and
absolutely
getting that fresh air.
Yes.
Yeah, that's cool.
And I'd say similarly, so I'm a big volleyball player, so I still play a lot of volleyball, which is excellent. So I try to do that to keep myself healthy, and lots of walks outdoors with the baby right now, just to kind of keep her in and out in different environments. And she got her vaccines yesterday, so hopefully she's on the,
So
the
you're
right
role
course
modeling.
for her.
That's good. That's
for
good.
her to stay nice and healthy this winter. And I agree with Scott 100% on the good hand washing, because it makes a big difference in kind of the spread of germs. And
Terrific.
Yeah, I think in addition to being active, being mindful of how stressed you might be, and trying to make an effort to address that, whether it's through meditation, exercise, or whatever.
That's an excellent point, Scott. I think that a lot of times parents are concerned about their child's stress level. We're in a very fast-paced world, and I think it's really important as parents, one of the most important things we can do is to take a genuine interest in what our children are doing, and that goes a long way for their mental health, which is important for their overall health.
What an excellent point. Excellent point. So, Dr. Haag, do you have any advice for our newcomers on settling into a practice?
Sure. I think the most important thing that you can do for yourselves to get to know your patients and for them to get to know you is to be involved in the community. We have a great and welcoming community, so do take advantage of that.
That is so true. I mean, it is about neighbors helping neighbors. It's about a community. You can be as involved as you want. And I was so impressed with a number of family things that that are offered here, across both Franklin and Grand Isle. There's some really cool things to be doing. So, yeah, take care of yourselves and your families, and therefore you'll be able to take great care of others. So that's terrific. So how our time is getting up here. So how do we find you? Do we call just Northwestern Pediatrics, or is that what we do, and then they'll route, or how does that happen?
So there's a main phone line that then is split into 2 different directions, and so you can get the Enosburg office now directly, or the St. Albans site, which also connects you to Swanton.
Okay, great.
So that's the best way to reach us. I believe there's also some information on the NMC website, with
okay.
some telephone numbers.
Excellent.
And soon to be a portal. So,
Excellent, great. So you can go to our website, can call Northwestern Pediatrics, and you'll get routed to the right place. And I'm assuming we're accepting new patients.
Always.
That's terrific. Well, thank you so much for being on the show today. It's wonderful to have you here, and it's great to have a mentor with Dr. Haag, and also other colleagues as well. So it's wonderful to have you here. So thank you for joining the show.
Thank you.
All 3 of you.
Yeah.
And I'm Jill Bowen, CEO of Northwestern Medical Center. Thank you so much for being here on the Health Beat show to learn about access to pediatrics and how important it is to drink water, to eat well, to sleep well, and to be physically active, and to really listen to your children and be a part of their lives actively. So thank you for joining us.